name is Vanessa, and today I'm going to be discussing the 10th cranial nerve, also known as the vagus nerve. First, I'm going to discuss its function in relation to speech and language pathology, and then I'm going to do a comprehensive assessment of this nerve and discuss what you'd be looking for if you were to do a screening for this nerve. Well, a brief overview. The vagus nerve is a really interesting nerve. It's unique in that it has the longest anatomical course of all the 12 cranial nerve. It is called the wandering nerve in Latin because it goes all the way from our head down to our abdomen. Although this video is not really focusing on its the anatomical portion of this nerve and discussing all the exit points and all the different organs that it innervates, I thought it'd be interesting just to note that it originates from the medulla oblongata. It exits through the jugular foramen, and it divides into several branches as it go down from the neck to the thorax and finally the abdomen. When we talk about the function of the vagus nerve, because it is a mixed nerve, it has both sensory and motor functions. So what that means is basically that this nerve not only receives information from the peripheral nervous system or from the organs that it innervates and send those information to the central nervous system, it also sends motor signals from the central nervous system and down back to the organs that it innervates. So it does two. When we talk about the sensory now, to be more specific, we can further divide that into two main components, which would be the somatic component and the visceral component. When we talk about the somatic, it's basically responsible for sensory information that is received from our skin and from the muscles. So, for example, the vagus nerve innervates the posterior aspect of our ear, the external acoustic meatus, which is our ear canal, and also the posterior aspect of the tympanic membrane. And going into the visceral component, we know that the vagus nerve is responsible for sensations that are felt in the organs in the body. So we have, for example, the gastrointestinal tract, the laryngeal pharynx, and also the superior aspect of the larynx, which is the area above the epiglottis. Now moving into the motor function of the vagus nerve, we know that it has. When we talk about the motor function of the vagus nerve, we know that it innervates the muscles of the pharynx as well as the larynx. The muscles in the pharynx is innervated by the pharyngeal branch of the vagus nerve. So we have muscles such as the superior, middle, and inferior pharyngeal constrictor muscles, the palatopharyngeus, and the subphalango-pharyngeus muscle. And if we were to have a lesion in the pharyngeal branch of the vagus nerve, we know that we will have difficulty swallowing because these muscles are responsible for swallowing. So those muscles in our neck helps us with swallowing. So a lesion will have what we would know as dysphagia. And more specifically, if we look at the palatopharyngeus and the subphalango-pharyngeus muscle, if we were to have a lesion there, it would cause the uvula to drop at the side that there is a lesion. So if it is the left side, the uvula would drop and it would lean toward that side, and that is how we would know that we'd also have a lesion in one of those muscles. And going down now into our larynx, we have the recurrent laryngeal branch, and also we have the external laryngeal nerve and the superior laryngeal nerve that is part of the branch of the vagus nerve. And these nerves, basically, when we talk about the recurrent laryngeal nerve, it's responsible for all the muscles that are implicated in phonation. So we have the vocalis, we have the thyroid arytenoid, the posterior cricoarytenoid, the transverse and the oblique arytenoid, and also the lateral cricoarytenoid. And all those muscles, basically, it helps us produce speech. It's the sound. So if you were to have, let's say, a weakness in if you were to have a weakness in the vagus nerve, and then specifically the recurrent laryngeal branch, then you would have someone who has difficulty with phonation. They could sound breathy, hoarse, they could have a weak voice because the vocalis or the muscles aren't abducting or adducting appropriately as they should be. And also, like, this is very dangerous, or it can actually cause death, because if your like glottis is not opened wide enough, because the vocalis, the vocal cord, is abducted, then you don't have enough air that moves from your subglottis and then past that area. So that is also a very interesting and important thing to note. It's a very important nerve in general, and not something to to overlook, I'm sure. So yeah, moving into the superior laryngeal nerve of the vagus nerve, if you have a unilateral lesion, you generally don't have dysphonia. But if you were to have a bilateral lesion, which is lesion of both sides, then you can have restricted pitch control. So you probably have like abnormal pitch. And you have other muscles such as the palatal glossus, part of the tongue, and a majority of the soft palate that is also innervated by the vagus nerve. So now that we have talked about both the sensory and the motor function of the vagus nerve, I am now going to do a comprehensive assessment and discuss what or how to look for a lesion in this nerve. Hello, so I have with me my sister Valerie, who will play the role of my patient. So hi Valerie, how are you doing today?
I'm doing good.
So I just want to talk to you a little bit so I can hear how you sound. So tell me a little bit about your day. What did you do today?
I woke up, I went to church, I went to pick up some items for a charity, and then I came here.
Good. Thank you for telling me that. So I just basically asked Valerie to talk a little bit, and while she does so, I'm gathering a short speech sample of her speech so that I can perceptually assess whether or not she has any hoarseness, breathiness, weakness in her vocal folds, or if her pitch is sound. And it looked like everything is sounding fine. So now, Valerie, I am going to ask you to cough for me. A little, like you could do it a little bit more time. Okay, thank you for doing that. I know during quarantine we probably don't want to do that too often around other people, but basically I asked her to cough so that I can assess her ability to close her vocal folds, and that is telling me the integrity of the recurrent laryngeal branch of the vagus nerve, which is responsible for the vocal folds. So it will abduct, it will innervates the muscles of the vocal folds and muscles that are responsible for phonation, and it will help the vocal folds to abduct, adduct, tense and relax. So Valerie sounded fine and she's able to cough. If she had a hollow cough, it would indicate to me that there is an impairment in the vagus nerve, but thankfully she does not. So now, Valerie, I am going to ask you to repeat the vowels A, E, I, O, U. Okay?
A, E, I, O, U.
Good. So she's able to do so successively, and the ability for her to successively say the vowels will let me know the integrity of her uvula, and if she didn't produce it in a manner that was excessive, if she was slow or she had any I suppose dysarthric characteristics, it would indicate that there is an impairment in the vagus nerve as well. So now, Valerie, I'm going to ask you to take a sip of water. Okay, so Valerie did not have any aspirations. She didn't have any difficulty swallowing, and we know that the vagus nerve is implicated in swallowing because the pharyngeal branch of the vagus nerve innervates the muscles in the pharynx. Thank you for that. Now, Valerie, what I'm going to do, I'm going to put on this glove, and I'm going to use a tongue depressor to take a look inside your mouth. Okay, so we have this tongue depressor here, and as I'm looking inside Valerie's mouth, can you say ah?
Ah.
Like all the way ah?
Ah.
As I'm looking inside, I see that the uvula is elevated. I also see that she has appropriate symmetry of her uvula. I also see that she has normal oral structures and symmetry of her palates, her soft and hard palates over here, as I see. And can you say ah again?
Ah.
Good. And her uvula is not leaning toward any side of her soft palate, which indicates that she doesn't have any impairment in the vagus nerve. So finally, I'm going to place a Q-tip down Valerie's soft palate to assess whether or not she has any gag reflex. And when she has a gag reflex, or if she has a gag reflex, it will be indicative of a functioning cranial nerve 10, a functioning vagus nerve. If she does not, then that will be a sign that there is an impairment in the vagus nerve. Okay? Okay, so as you can see, Valerie had a gag reflex, therefore her vagus nerve is functioning properly. Alright, Valerie, thank you so much for coming to see me today. I assessed your vagus nerve, and I noted that everything was normal. There was no issues. You were able to drink water without aspirating, without any difficulty with swallowing, and you had the appropriate reflexes that you needed, and your oral structures is functioning and it's normal. Thank you so much for coming. Thank you so much for participating as my patient.
You're welcome.
This concludes the comprehensive assessment portion of this video. To recap, the vagus nerve is the 10th cranial nerve. It is the longest of all the 12 cranial nerves. Therefore, in Latin, it means the wandering nerve. When we look at the vagus nerve, in terms of function, it is a mixed nerve. It has both motor and sensory functions. When we look at how it is coursing down from the neck to our abdomen, it has several branches in the neck, in the thorax, and in the abdomen. It's significant for speech and language pathology, and damages can lead to impairment in speech, hearing, and swallowing. Thank you so much for watching this video. Bye-bye.